Arthritis causes, symptoms, and treatment. If you feel pain and stiffness in your body or have trouble moving around, you might have arthritis. Most kinds of arthritis cause pain and swelling in your joints. Joints are places where two bones meet, such as your elbow or knee. Over time, a swollen joint can become severely damaged. Some kinds of arthritis can also cause problems in your organs, such as your eyes or skin. Many people think that arthritis is a specific condition, but it's actually a general term for joint disease or joint pain, and in fact, there are over 100 different types of arthritis in addition to conditions related to arthritis. It's a complex health issue with many different variables, although arthritis is often associated with an older population, and there are types of arthritis that are more common among older adults. Anyone, even young people, can be affected. Arthritis can afflict both genders, but it's more common in women than in men. So the first question is, what causes arthritis? Most forms of arthritis are thought to be caused by a fault in the immune system that causes the body to attack its own tissues in the joints. This may be inherited genetically. Other forms of arthritis can be caused by problems with the immune system or by a metabolic condition, such as gout. Lack of cortisol. Cortisol, it's the main anti-inflammatory hormone in the body. In acute inflammation, cortisol is needed as part of the inflammatory, healing response. The natural purpose of elevated cortisol is activation of the body's immune defenses and healing to eliminate the cause of pain and facilitate tissue recovery. Glucose sugar. High blood glucose levels can lead to chronic inflammation, which can cause joint problems for some people. This is because high blood sugar levels can lead to an overproduction of reactive oxygen species, or ROS, in your body. Consuming too much processed sugar causes the body to release pro-inflammatory proteins called cytokines. Cytokine levels are already high when you have inflammatory arthritis. That chronic inflammation is what causes pain, swelling, and stiffness in your joints. Overweight. Your body weight dramatically affects your chances of developing arthritis. Being overweight directly causes nearly 1/4 of all diagnosed cases of arthritis. And if you're obese, you're 60% more likely to end up with arthritis compared to people who maintain a healthy body weight. Overweight women have nearly 4 times the risk of OA. For overweight men, the risk is 5 times greater. Being overweight is a clear risk factor for developing OA. Population-based studies have consistently shown a link between overweight or obesity and OA. Old injuries. Unfortunately, many people also develop arthritis months to years to decades after they've sustained an injury. This is known as post-traumatic arthritis. Post-traumatic arthritis makes up about 12% of knee, hip, and ankle osteoarthritis cases, which is about 5.6 million Americans. Low vitamin D. Studies also have found that a lack of vitamin D is linked to rheumatoid arthritis, an autoimmune disease characterized by swollen, aching joints and numbness and tingling in the hands and feet. Too much iron. Iron is a mineral. It's a trace mineral that you don't need in large amounts, and our bodies don't have mechanisms to get rid of iron. When you get an infection, both the good bacteria and the pathogens compete for this iron. Apparently they eat iron. And so our bodies have this interesting mechanism to bind up iron during infections. And this is why people have a higher incidence of getting anemia when they have infections. Iron in general in large amounts can create inflammation. So in today's video, I'm going to share with you the top 7 signs of arthritis disease to watch out for. Just a quick reminder that this video is solely intended for educational reasons. If you have any medical concerns, talk to your doctor right away. Symptoms of arthritis. Arthritis symptoms can vary depending on the type of arthritis and the individual involved. The most common symptoms include 1. Joint pain. Arthritis commonly affects joints in the hands, wrists, and knees. In a joint with RA, the lining of the joint becomes inflamed, causing damage to joint tissue. This tissue damage can cause long-lasting or chronic pain, unsteadiness, lack of balance, and deformity, misshapenness. 2. Joint stiffness. Joint stiffness is the feeling that the motion of a joint is limited or difficult. The feeling is not caused by weakness or reluctance to move the joint due to pain. Some people with stiffness are capable of moving the joint through its full range of motion, but this movement can require force. If your hands are affected, you may not be able to fully bend your fingers or form a fist. Like joint pain, the stiffness is often worse in the morning or after a period of inactivity. 3. Arthritis Mutilans. Arthritis Mutilans (AM) is a rare condition that develops in approximately 5% of patients with psoriatic arthritis. Arthritis mutilans is a severe, rare, and destructive type of arthritis that is most commonly seen in people with psoriatic arthritis. Arthritis mutilans may also occur in rheumatoid arthritis, but that is rare. The condition damages and destroys joints and bones. Normally, bone cells break down and rebuild. But when you have arthritis mutilans, the bones do not rebuild. Instead, the soft tissues of the bones collapse. Arthritis mutilans can impact the fingers, hands, wrists, and feet. The condition is sometimes called opera glass hand or telescoping finger. Since the joints and bones are so damaged, when you pull on the involved fingers, they can look like the opening of opera glasses. Telescoping fingers refers to when the bones dissolve and the soft tissues can't hold the fingers up, so the fingers end up looking like a telescope. 4. Swelling of the knee. A knee joint affected by arthritis may be painful and inflamed. Generally, the pain develops gradually over time, although sudden onset is also possible. There are other symptoms, as well. The joint may become stiff and swollen, making it difficult to bend and straighten the knee. 5. Swollen joint. In rheumatoid arthritis, the body's immune system attacks the lining of the joint capsule, a tough membrane that encloses all the joint parts. This lining, synovial membrane, becomes inflamed and swollen. The disease process can eventually destroy cartilage and bone within the joint. 6. Ankle pain. When rheumatoid arthritis affects the joints of the foot and ankle, inflammation can make it painful to walk and difficult to wear shoes. The foot and ankle contain 30 joints, and those joints are particularly susceptible to inflammation in people who have rheumatoid arthritis (RA). At least 90% of people with RA experience inflammation of the foot and ankle joints at some point in their. 7. Wrist pain. Arthritis can cause swelling and pain in the wrist joints. Over time, this inflammation can lead to permanent damage, resulting in changes to the shape of the wrist joints. A person with arthritis may also notice nodules forming near the wrists. These are small, firm bumps. Let's now take a look at lifestyle changes that you can make to help remove any arthritis from your body, allowing it to heal naturally. 1. Manage your weight. The effects of your weight on arthritis symptoms might be significant. Your knees, hips, and feet are most affected by more weight on your body. If you have OA and are overweight or obese, the American College of Rheumatology and Arthritis Foundation's ACRAF recommendations highly suggest decreasing weight. Your doctor can assist you in choosing a goal weight and creating a plan to get there. Losing weight can assist in lowering joint tension by gain greater mobility, reduce discomfort, and guard against further joint harm. 2. Get enough exercise. Exercise is good for arthritis sufferers because control your weight, keep your joints mobile, and build up the muscles around them for greater support. Current recommendations strongly urge beginning a suitable workout regimen. It may be especially advantageous to exercise with a trainer or another individual because it boosts motivation. Low-impact exercise is a good choice, such as Tai Chi, swimming, water sports, and walking. 3. Use hot and cold therapy. Treatments using heat and cold can reduce inflammation and pain associated with arthritis. An electric blanket or moist heating pad can be used to assist discomfort overnight, as can taking a long, warm shower or bath in the morning to aid with stiffness. Cold therapies can reduce inflammation, edema, and joint pain. Apply a gel ice pack or a bag of frozen vegetables to sore joints after wrapping it in a towel. Never apply ice to your skin directly. Some over-the-counter topical ointments and lotions contain capsaicin, a compound derived from chili peppers. These items offer warmth, which helps relieve joint pain. 4. Take vitamin D. Upping your vitamin D intake has been shown to help with symptoms of rheumatoid arthritis. Vitamin D helps the body absorb calcium, which is essential for building strong bones. Too little of this vital nutrient can lead to having thin, soft and brittle bones, known as osteomalacia in adults and rickets in children. When vitamin D levels are normal, RA symptoms and pain and overall health are improved. The National Institutes of Health recommends a dietary allowance of 600 international units IUs per day of vitamin D. People who are deficient need more and may benefit from taking 1 to 2,000 IUs per day. 5. Consider herbal supplements. Here are a few herbs to help stem inflammation and aid the body in its detoxing efforts. Please note that these herbs are helpful for anyone with illness, not just arthritis. 1. Turmeric or Curcuma longa. Turmeric is an extremely effective anti-inflammatory herb, and thus an effective pain reliever. It contains at least 2 chemicals, curcumin and curcuminoids. These chemicals decrease inflammation and are very much like the oft-prescribed non-steroidal anti-inflammatory drugs, or NSAIDs. Incidentally, this anti-inflammatory effect is also why turmeric is often recommended for treatment of cancer, cataracts, and Alzheimer's. While you can totally add this spice to your daily diet, you will need to take turmeric in supplement form in order to experience the full medicinal benefits. When cooking, try adding black pepper or dried ginger to help activate turmeric. The herb can also be applied topically to relieve pain. 2. Licorice or Glycyrrhiza glabra. Licorice acts much like your body's own natural corticosteroids, which reduce inflammation. Licorice decreases free radicals at the site of inflammation and inhibits the enzyme production that's involved in the inflammatory process. Glycyrrhizin is the component in licorice which blocks and relieves inflammation. It also supports the body's release of cortisol, which suppresses the immune system, easing the pain and occurrence of arthritis. It also inhibits some of the side effects of cortisol, such as adrenal fatigue and anxiety. Use this in supplement form or as a tea. Please note that licorice is not a good remedy for those with blood pressure issues. People who regularly take large amounts of licorice, around 20 grams a day or more, may experience serious side effects such as headaches, high blood pressure, and heart problems. If you already have high blood pressure, heart or kidney disease, or low potassium or hypokalemia, please avoid the herb altogether. 3. Nettles or Urtica dioica. If you have heard of nettles before, then you know that nettles is an herb with mad skills, incredible for pretty much anything. Nettles are insanely good for you. It contains protein, calcium, phosphorus, iron, magnesium, beta-carotene, along with vitamins A, C, D, and B complex, all in a form that is easy for the body to use. Stinging nettle is a wicked herb for those with all types of arthritis and gout. Its anti-inflammatory amazingness combined with its minerals like boron, calcium, magnesium, and silicon ease pain while helping to build strong bones. While NSAIDs are often a necessary evil for most with arthritis, using nettle may help you to decrease the amount you need to take. As a precaution, always discuss herbal supplementation and prescription decreases with your physician. A cup or more of nettle leaf tea relieves and prevents water retention and inflammation and nourishes the kidneys and adrenals. As a side note, many arthritis sufferers have found that striking the inflamed joint with a fresh cutting from a nettle plant helps relieve joint pain, as the stinging part of the nettles draws blood to the joint, relieving pain and inflammation. I know this sounds like a nutty treatment, but the brave amongst you can give it a try. 4. Flax Linum usitatissimum. Flaxseed is one of the best vegan sources of omega-3 or ALA, which is so important to a strong immune system and for fighting inflammation. The vegan bit is important because animal fats often lead to inflammation in arthritis sufferers. Try to include 2 tablespoons of flax seeds or flaxseed oil in your daily diet. However, do not heat or cook seeds or oil. Also, if you suffer from a digestive condition such as irritable bowel syndrome, use the oil rather than the seeds, they could irritate your condition. 5. Burdock Root or Arctium lappa, or Urtica. One of the greatest things you can do for pain, joint, or otherwise, is to increase your intake of essential fatty acids. Burdock contains fatty oils, which combined with its sterols and tannins, can contribute to burdock's reputation as an anti-inflammatory. You can eat burdock root in stir-fries, which is very popular in Asian cuisine, or make a decoction. To do a decoction, simply chop 2 tablespoons of fresh burdock root. If you do not have the fresh root available, you may use 2 teaspoons of dried root as an alternative. Add the root to the boiling water and allow to simmer for 10 minutes before turning off the heat. Strain and drink while still warm. Drinking 3 to 4 cups a day is ideal. You can also take the herb in capsule form. Be sure to calculate the appropriate dose using your own weight. All in all, aside from herbal protocols, the best treatment for arthritis is a diet filled with fresh produce, essential fatty acids, and fiber. You should also reduce or eliminate foods that cause an inflammatory response, such as fried foods, animal fats, dairy, and anything else which might cause an allergy sensitivity. Yoga and gentle stretching go a long way toward arthritis prevention and pain relief by opening joints and encouraging the distribution of synovial fluid, which lubricates the joints. Thank you so much for viewing my video today. As usual, I send you my best wishes for good health, prosperity, and happiness.